Well, good afternoon. I'm here today with Minister Elliott, Solicitor General Jones, and Craig Bradbrook, Chief Operating Officer from the Greater Toronto Airport Authority at Pearson International Airport. Pearson is the busiest airport in the entire country. We have over 60,000 people coming through this airport from international destinations each and every week. And amid this terrible global pandemic, as we face this deadly threat, we need to do everything in our power to secure our borders. We need to do everything possible to stop this virus from coming into Canada. Here in Ontario, we are doing our part. We have made terrible sacrifices here at home. The people, they are doing what's necessary to protect our communities. But all the while, COVID-19 has been getting into our borders from outside Canada. Since September, over 1,300 flights in Canada have had potential COVID-19 exposure. In fact, over 31 international flights with COVID-19 have landed in Toronto in the past 2 weeks alone, since I last called for tighter restrictions at our borders. My friends, we have to get these borders under control. While protecting Canada's borders remains federal jurisdiction, we here in Ontario are ready to do our part. We've been working closely with the federal government on the issue for months, and I was happy to recently see them move on a request to require pre-screening test for inbound passengers. This is a critical step, and I want to thank the Prime Minister for making this decision. But more can be done. Before the holidays, I made a promise to the people of Ontario that we would do everything in our power to get testing at our airports. My friends, today we're delivering on that promise. We are launching airport testing at Pearson Airport. Starting today, travelers coming into Pearson will be able to take a free and voluntary test. It's a game changer. And while we're taking these steps, we're actively working with the federal government to further enhance this program. And I hope to have more good news to announce in the coming days. We will continue to work with the Prime Minister and his team on this, because right now we need to stick together. We need to work together. That's what people expect. And by sticking together, by working together, we will get through this. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. The health and well-being of Ontarians has been our government's top priority throughout the pandemic. Today, we are once again making good on our promise by offering free and voluntary COVID-19 testing for eligible international travelers arriving and staying in the province for at least 14 days. This pilot will add an extra layer of protection for Ontarians, helping to quickly identify and stop the spread of COVID-19 upon arrival. Inbound international travelers can register to participate in the program at torontopearson.com/testing or in person upon arrival at Pearson Airport. Travelers choosing to participate in the pilot will receive a self-administered test that will be supervised by a healthcare provider, either in person or by video, in a convenient and dedicated space in Terminals 1 and 3 here at Toronto Pearson. Test results will be reported into Ontario's Lab Information System within 48 hours, and Public Health will follow up on all positive tests. All international travelers will continue to be required to follow the mandatory 14-day quarantine after arriving or returning to Ontario, regardless if they have a negative or positive test. This pilot is in addition to the new Government of Canada requirements for travelers coming to Canada to have a negative COVID-19 test, and will act as another layer of protection for our communities. I want to thank our industry partners, such as the Greater Toronto Airports Authority and Switch Health, in helping achieve our goal of keeping people safe and stopping the spread of COVID-19 in our communities. And we will continue to work with the federal government to implement the next stage of our pilot, which would include a modified quarantine period for participants who test negative. But today's pilot is a great step forward in protecting our borders. Until then, it remains critically important for everyone to follow public health advice. I urge you to continue following these small but important measures to protect yourself, your loved ones, your frontline heroes, and your communities, and to stop the spread of the virus. Thank you. And now I would like to invite to the podium Craig Bradbrook, Chief Operating Officer of the Greater Toronto Airport Authority, to say a few words.
Thank you, Premier Ford, Ministers Elliott and Jones. My name is Craig Bradbrook and I'm the airport's Chief Operating Officer. I'm very pleased to be part of the announcement today and to join with the Government of Ontario to launch arrivals COVID testing at Toronto Pearson. I'm proud to say that the ongoing commitment to letting science and data lead the way continues with today's announcement. And I want to specifically point out how instrumental Premier Ford and his government have been in supporting this important work. The Ontario Airport testing provides another layer of protection for Ontarians, supporting the early detection, tracing, and isolation of COVID-19. Along with many other measures to protect the health and well-being of our workers and traveling public, we believe testing will support a safe, evidence-based approach to restarting air travel. We're pleased to continue to see the governments of Ontario and Canada collaborate on possible COVID-19 testing programs at airports that could support the eventual safe reopening of borders, which would significantly reinvigorate the aviation industry's strong contribution to the economy. Toronto Pearson has been on this data-driven, science-based journey for months now, starting with our Healthy Airport launch in June. At the heart of Healthy Airport is a cleaning regimen informed by an industrial hygienist and a chief medical officer. Healthy Airport also utilizes the latest in proven innovation, such as UV light disinfection and industrial fogging. Our Healthy Airport program prioritizes partnerships across the industry for the health of passengers and employees. The spirit of that partnership also led to a world's first study by McMaster's Health Lab here at Toronto Pearson, which we co-sponsored with Air Canada. The key data from the study support a testing regime can safely enable shortened quarantines. We're pleased to see those results informing government decisions on arrival testing programs like the one we are announcing today. I would like to thank Premier Ford and the many other collaborators involved in the launch today. An unwavering focus on health and the recovery of the aviation industry are not mutually exclusive. I look forward to the contribution this testing program will make to the base of knowledge around COVID-19 and the safely restarting of air travel. Thank you very much.
We'll go to the phone line for questions. First question, please.
Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier.
Hi.
Since we last talked to you December 22nd,
Yep.
A lot has changed. Cases have been skyrocketing. We've hit over 3,000 consistently. ICUs are above the threshold where they say hospitals cannot perform surgeries. There are 2 hospitals at least that now have temporary morgues because their morgues are full. Is the government doing enough to stop the spread? Do you need to look at the lockdown and clamp down further, kind of like what we're hearing Quebec is going to announce later today?
Well, we're working with our chief medical officer on that exact item. We're doing everything we can. We're throwing everything at it that we can, no matter if it's testing right here is a perfect example. Really picking up on the vaccinations. We did over 10,000 vaccinations as of yesterday, and we're going to continue ramping it up. We need more vaccines. We're going to run out. The shipment that's landing that we got 24 hours notice on, that's going to be gone next week. The previous shipment's going to be we're going to run out tomorrow, I think Friday at the latest. So we need more vaccines, and I know the federal government's doing everything they can to get those vaccines. I had a good conversation with the Deputy Prime Minister last night. She's working her back off as usual, and I know the Prime Minister is, everyone is. and we're all working together. But the quicker we can get these vaccines into people's arms, the safer we'll be.
Follow up?
Before Christmas, Premier, you dismissed the idea of a curfew. Yesterday, you said everything was on the table. Are you considering a curfew? Do you think that that would work, or do you think it would further alienate people who are getting tired of this lockdown?
Well, I think everyone is tired of this lockdown, but again, Cynthia, I think the quicker we get these vaccines into people's arms, the quicker we can move forward, and that's what we need. I'll talk to the chief medical officer regarding any further restrictions, but twofold. We have to continue practicing social distancing, washing our hands, and making sure when possible stay at home. That is absolutely key. But even more important, the more vaccines we have, the quicker we can get them into people's arms. We're ramping up, and again, there's no one in the country that's vaccinating 10,000 people a day. We're going to continue leading, and I just want to clarify something. There's no vaccine sitting in any freezers. We're running out of vaccines.
Next question.
From Rob Ferguson at the Toronto Star.
Hi, Rob.
Hi, Premier. I'm just wondering what has happened with the Pfizer vaccine. We were told yesterday that you can now worked out some kind of scientific protocol to get it, on the road and into nursing homes, which apparently couldn't be done initially, and yet Quebec did it. And since then, the last few days, we've had 2 healthcare workers die. One personal support worker in Windsor, and yesterday a nurse at a nursing home in Mississauga. So, don't you think you made a mistake by not getting that Pfizer vaccine out sooner? And maybe it could have saved these 2 lives.
Well, first of all, my prayers and thoughts go out to the families of the 2 healthcare workers. We're following instructions not only from the federal government, from Pfizer themselves, saying we were not allowed to move it. Now we're going to move it and do a trial out in Ottawa, and hopefully this is going to go smoothly and we'll be able to get it out. But again, we're following the instructions from the company themselves and the federal government. So we're gonna do the trial out in Ottawa, and once we're able to do it, then we'll start moving it around.
Follow up?
Yeah, I'd be curious to know, maybe the health minister could chime in on this. What has changed in terms of the guidance? How can some jurisdictions do it, others not? And we end up doing it anyway. And it seems like another one of the cases where we waited to do something and we lost time.
Yeah, I'll pass it over to the minister, but we aren't waiting for anyone. We had to follow the instructions from the federal government, from Pfizer, very clear instructions not to move it. And now, I guess further instructions came from Pfizer that we're able to move it. I'll pass it to the minister.
Well, we were following the instructions that we received from Pfizer, very strict at the beginning, saying that once the vaccines were delivered to one location, that they should not be moved. We're learning more. Pfizer's learning more about this as well, and so now that we understand that it may well be safe for people to receive vaccines that have been moved from hospital to perhaps a long-term care home, we're following that. But we have always followed the instructions that we've needed to make sure that every step we take is with the health and safety of Ontarians first and foremost.
Next question.
From Sean Jeffers at the Canadian Press. Please go ahead.
How you doing, Sean?
Good afternoon, Premier. I wanted to ask you about former Finance Minister Rod Phillips. You acknowledged that you had a conversation with Minister Phillips, and you made a mistake by not ordering him to come back from his vacation immediately. But that only came after initially you said that you weren't aware of the trip. I'm wondering if you can explain that discrepancy there.
There's no.
And I also wanted to ask if you are aware of any other members of your cabinet, your government, or your staff who traveled over the Christmas break and broke the rules.
Yeah, thanks for the question. I didn't contradict myself. I didn't know about the trip. He got on the plane. Shortly after he arrived, I just called him and found out. I take full responsibility for that. I'm very, very clear with our caucus and cabinet not to travel. It happened. Now, now I guess the former minister is paying the consequences. We take it very seriously when people aren't following the instructions, not only of the province of Ontario, but the federal government about restricting travel, especially outside the country.
Next question, please.
So, Premier, I just want to make sure I
Yep.
get a clear answer here. So, are you saying that you were not aware of your staff or any other member of your government having broken the rules or having traveled over the Christmas break?
Again, I'm going to repeat what I said. I made it very clear to everyone not to travel, and I made it very clear to our caucus and cabinet members about traveling, and I didn't find out until I made the phone call. So.
Next question.
Yeah.
From Randy Rath at CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. I'm wondering, do you think that Dr. Tom Stewart should resign or be fired from his $600,000 a year public service job?
Yeah, that's going to be up to the board. They're going to have to make a tough decision. I made the tough decision with my finance minister. It's up to the board. The government of Ontario doesn't get involved in day-to-day operations of hospitals out there. That's up to the board of directors and the president and CEOs. So we'll leave that up to the board to make that decision.
Follow up.
With respect, Premier, I was asking for your opinion, not if you have the ability to do it. But
Yeah.
I'm also wondering about, over the last few days, there have been several infectious disease doctors and medical experts that are saying that the lockdown isn't working because it isn't a true lockdown, that schools should not go back when they're scheduled to go back.
Mhm.
If everything's on the table, is children not going back to school, the schools not reopening, a possibility?
Well, we're going to talk to the health table and the chief medical officer and get their advice. That's the expertise that we're going to take. And we're going to take that advice, and we'll be announcing that in the next day or so.
Next question.
From Mike Crawley at CBC News. Please go ahead.
Hi, Mike.
Premier, I just want to ask you about the vaccine rollout. You know, you mentioned that you're vaccinating at the rate of 10,000 a day, but that was actually only yesterday was the first day that you managed to do 10,000 a day. But with the number of doses that you have between the two different vaccines that you have available now and that are in the pipeline over the course of the next month, there appear to be enough that you would be able to vaccinate every resident of long-term care in the entire province by the end of January.
Yeah.
Why can't you, make that commitment given the seriousness of the risk to people, to the residents in long-term care?
Oh, good question, Mike. I just want to correct you. We don't know what we're getting a month down the road. We get 24 hours notice on what we're getting, and if you've ever run logistics at all, it's a nightmare when you have a large operation and you're getting 24, 48 hours notice before we get the shipment. We will run out of the Pfizer vaccine by today or tomorrow at the latest. The new shipments arriving, we'll run out of that by next week. We need more vaccines. The Moderna has been allocated for long-term care, and we're going to be working to make sure that we have all in the hot areas, as we call them, Windsor, Essex, Peel, Toronto, and York. Everyone will be vaccinated in long-term care, not only the patients, but the workers as well. We'll be moving into other regions across Ontario and get patients and workers vaccinated immediately. So we aren't delaying. As soon as we have it, we're going to have people vaccinated.
Follow up.
And I just want to ask you a little bit more about this idea of copying what Quebec is doing with the curfew and tighter restrictions. How seriously are you considering adopting what Quebec is doing? When are you going to make a decision about that? Given the rate of infections, running at 3,000 a day, it seems like it would be something kind of urgent.
Yeah, well, everything's urgent when it comes to this pandemic, Mike, and we're moving at the pace of lightning, as I say. I'm going to have a conversation with Premier Legault tonight and have a good chat with him. I'm going to be speaking to the health table later today, and we'll be making that decision over the next few days.
Last question.
From Brian Lilly of the Toronto Sun. Please go ahead.
Hi, Brian.
Premier, you're saying that you need more vaccines.
Yeah.
I realize it's taken a while to get up to this speed, and I can see you're running out of them. So I'd like your reaction on the story out of Kingston that the federal government will begin to vaccinate inmates in federal prisons starting this week, even though the National Advisory Committee on Immunization recommends that inmates should be offered a vaccine after residents of long-term care, staff, the elderly, and healthcare workers, as well as Indigenous communities, have already had their vaccines.
Well, when I first heard it, I didn't believe it. I had to get my team to double check that they had the information right, because what I understand, you're giving the most dangerous criminals in the entire country. Folks, these are people that are in federal prison penitentiaries. Again, the most dangerous criminals in the entire country. How do you square this? How do you put them ahead of long-term care patients? How do you put them in front of all the most vulnerable? And we're scraping every vaccine we can get. I imagine whoever the minister is in charge of that has dropped the ball major league. And we all make mistakes. I make mistakes, but hey, let's correct it. Let's not give the most dangerous criminals in our country the vaccine before we give it to our long-term care patients, most vulnerable, and other elderly people. I still can't believe it's going to happen. So I encourage the federal government. I encourage the Prime Minister. Stop it. It is not good at all to give the most dangerous criminals in our country vaccines over the most vulnerable people out there, especially going by their guidelines too.
Follow up.
How is, and I'd like to hear from you, Premier, and from Minister Jones, how is the Ontario government going to handle vaccinating inmates in provincial penitentiaries, local detention centers? We know that congregate care settings can be a problem. Are you going to be looking at vaccinating inmates soon, the way the federal government is? Are you looking at vaccinating guards first, the way you did with PSWs for long-term care, because they bring it in? What's the plan?
Well, I'm going to pass it over to the Solicitor General. I think the world of our correctional services officers. They need to be a priority. But something, I'll let the General ask about the prisoners.
Thank you. So we've made a very clear decision as a government that our priorities are going to be long-term care residents, the staff that work within those facilities, as well as healthcare workers and critical volunteers who are in those facilities. In terms of moving forward, as we continue to vaccinate, certainly group homes that have developmental disability, adults and children, and congregate living, like our corrections facilities, will be in the queue. But right now, our priority continues to be long-term care residents. Thank you.
Thanks, everyone.
Thanks, everyone. Thank you.